Good morning. I'm Anna Marie De La Vega. This is Focus. Thank you for joining us today. Now, today, I think you're going to learn a whole lot about transplants and kidney transplants in specific that you never knew and that you might need to know sometime in your life. Our guest today is Dr. Jacques-Franz Guiteau. Welcome. Thank you for joining us.
Thank you very much for having me on.
He's a transplant surgeon from the Ascension St. Thomas West Kidney Transplant Center, correct?
Yes.
Now, first thing when he came in, I said, okay, now tell me how to pronounce your name. And you said, you gave me the English version.
Yes.
Jacques Guiteau.
Yes, that's what everyone calls me.
But you said when you use the French accent?
Yes, when my mom talks to me, she says Jacques-Franz Jacques Guiteau. And that's how I know I'm in trouble. Even though it sounds beautiful, that's when I know I've really done something wrong.
Is she here?
She's in South Florida. Mm-hmm. Yeah.
Would you give people a little bit of like your kind of where you're from and your credentials so they know who we're talking to today as we talk about kidney transplants?
Absolutely. I think my first foray into transplant was in Houston, Texas, when I was doing my general surgery residency after finishing medical school at Emory in Atlanta. And at first I thought I was going to be a surgical oncologist, but realized that, you know, when you're looking at the outcomes after surgical oncology, they're not really as good as what you would see in a transplant. And the relationship that I'm able to build with my transplant patients really is what put me in the direction of going into transplant surgery rather than surgical oncology. So I pivoted in my second year of general surgery residency and actually did a 2-year research sabbatical with the transplant surgeons at Baylor College of Medicine before finishing up my general surgery and then going on to do my transplant fellowship at Baylor College of Medicine with my mentors in Houston, Texas. So
wow.
It was a wonderful time. I know that sounds like a long time, 7 years, 9 years with the fellowship, but it was all worth it.
You seem like a wonderful person. I'm just going to say that right off the start. I think people need to know that there are wonderful people ready to take good care of them and give them good medical advice, and they shouldn't be afraid. Because I think a lot of people are scared of like, okay, kidney stuff, I don't know. Surgeries, I don't know. And I think they need to know that there are real people who are very, very talented and very educated, ready to take care of them.
I think that's a great point. I think when people hear kidney transplant surgery, they start turning around and running for the door, right?
Yeah.
And I think it's scary to undergo a big operation like a kidney transplant or any type of transplant or any surgery for that matter.
Yeah.
But I think when you look at the outcomes from the majority of the surgeries we perform, they are so good. And the fear of going under or getting operated on really turns people away from what can be a life-saving and life-altering procedure where there is a period of time when you need to recover from the operation itself, but your life is changed forever and you live longer.
Okay, I heard you almost say going under the knife because that's what people call it.
Right.
I ain't going under the knife. But if you have kidney disease, first of all, let's talk about what that is. And then we'll compare like dialysis at end stage or transplants. We'll kind of compare that. Is that okay?
Yeah, absolutely.
So what would cause someone to need the services?
In the United States, and here in Middle Tennessee as well, the number one cause of kidney disease is diabetes followed by high blood pressure.
Oh, wow.
And I'm sure every single person listening to this at this interview knows somebody who has diabetes or high blood pressure if they don't have it themselves.
Yep.
And I don't mean to say that in a scary way.
No.
But those are the number one and number two causes of kidney disease. And the thing about both of those disease processes is that they are silent. You don't understand or know what's happening to you until you are visited with your physician and you get lab work looking for a specific blood test. Mm-hmm. And that's what happens with kidneys as well. You don't know your kidneys are failing until most of the time you are either getting regular lab work or you're getting to the point where your kidneys are getting so bad you're having symptoms.
What are symptoms?
The way I like to think about symptoms in kidney disease is to look at what the kidney does. Your kidney regulates your water, so it's really about determining what your water balance is in your body. Mm-hmm. It also regulates blood pressure. It also regulates some production of red blood cells, so like your blood count and your hemoglobin. And so when you have dysfunction of your kidneys, you have dysregulation of your water. So you start to develop swelling in your legs, swelling in your lungs, even sometimes swelling around your heart, which can be really scary. Mm-hmm. That same imbalance causes you to have increases in some of the electrolytes in your blood. In particular, we really look at potassium levels. Mm-hmm. And people with kidney disease can have really high potassium levels, which can lead to your heart going really quickly and causing really bad problems, even potentially dying.
Oh my gosh.
Most of the time, that's not the first thing we notice when someone with chronic kidney disease, but it is one of the potential side effects if it goes untreated. And so when someone comes in and they have swelling and they have shortness of breath, and we take a look at their lab work, one of the things we tend to look at is how well their kidneys are functioning. Mm-hmm. And the wonderful thing about kidneys is that if you get sick, that your kidneys may start to malfunction for a little bit of time, but once you get over that sickness, they can recover. But after a period of time, especially if you have diabetes, high blood pressure that's been putting a lot of stress on your kidney, you may come down with a really bad flu, or let's say you get COVID. That could tip your kidneys over, right? And so a lot of times people will come to us and say, I was feeling completely fine until I was in the hospital for 3 months after I had COVID. And what we really see from that is that their kidneys were kind of chugging along a little bit subpar, but then that acute illness is what tipped their kidneys over into them needing treatment for their kidney disease.
Wow. What is treatment for kidney disease?
Well, as your kidneys start to fail, really the only treatment when you get to the point where your kidneys are functioning, let's say about 15 to 10%, is really looking at renal replacement therapy. And so renal replacement therapies that we think of are dialysis, hemodialysis or peritoneal, and transplant.
Okay, would you explain those first two?
Yeah. So hemodialysis and peritoneal dialysis is the use of a machine to perform some of the functions of a kidney. In particular, they do a good job of regulating your fluid balance and some of those electrolytes that I talked about. Mm-hmm. You will have to take some medications to deal with the low hemoglobin levels, some shots maybe. You may have to take some medications to regulate phosphorus, calcium, things like that, that your kidneys also are responsible for.
Dang.
But I will say dialysis is only worth probably 20% of a functioning kidney. Mm-hmm. And so even though you may be on dialysis, it does perform the life-saving functions of a kidney, but you are not getting the full treatment or the full replacement of what your kidneys do. And that's why a lot of people on dialysis have fatigue. They are on disability. They aren't able to work because even though they go to their dialysis sessions, they don't have the energy, even afterwards, to really function day to day.
And dialysis is doing what?
So in hemodialysis in particular,
which is
the blood version. And
blood,
so the blood comes out of your body, goes through a machine, gets put back into your body after it gets filtered through that machine. And so the kidney is essentially the machine that it's going into. Peritoneal dialysis is where they take fluid. It actually goes into your abdomen. That fluid sits in there overnight, and natural diffusion and osmosis between the lining of your intestines or your stomach causes your body to filter through that way. So peritoneal dialysis is what sometimes people consider to be a little bit more gentle, and it's traditionally what people do when they do dialysis at home. But you also can do home hemodialysis as well.
Really?
Yes.
And you said the hemoglobin or the blood cells. Why are they important?
Well,
what role do they play?
So the blood cells are what carry your oxygen around your body.
Oh, okay.
So when you're breathing and oxygen goes into your lungs, it gets onto your red blood cells, which then goes and carries it to the rest of your body, your muscles, your heart, and all of those things. So if you have really low levels of hemoglobin, you potentially could have really low levels of oxygen going throughout your body.
Is that anemia?
Exactly. That's exactly. So anemia is low hemoglobin levels.
Because I have been anemic like a lot of times during my life, and I think a lot of women tend to be.
That's absolutely right. So kidney disease is only one of the many things that can cause anemia.
Yeah.
I think in particular, when you look at, some people when they're on their cycle can get heavy menstruation and they can get anemic from that. There are a lot of different reasons why a lot of medications can cause anemia as well. So there are a lot of different reasons why people can be anemic. But in particular, for kidneys, the kidney releases a hormone that tells your bone marrow to increase your red blood cells. And when your kidneys start to fail, they stop releasing that hormone and your body doesn't produce enough red blood cells.
Whoa. And so the dialysis helps trigger that or replace that?
So dialysis actually doesn't do anything for that. You have to get an extra shot that will tell your body to produce those red blood cells.
Whoa.
So not only are you on dialysis to do some of the function of the kidney, you also need to get shots, and you also need to take medications to replace some of the other functions as well.
So high blood pressure and diabetes, you
Yes.
said, are two of the main things that cause kidney damage.
Yes.
Any other things that we're doing and don't realize, okay, that could be messing me up later in my life?
Yes. So there are a lot of medications that can cause kidney damage. And so a lot of us take things like non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, Excedrin. All of those medications, if you take them frequently, over time will scar and damage your kidneys.
Holy cow.
Yeah, I mean, those are just over-the-counter medications that you can pop as many as you'd like.
And they're called NSAIDs or something like that, right?
NSAIDs, exactly.
So I've heard of overdoses. People thinking, well, I'm going to take some Tylenol and then I'm going to have some NyQuil and I'm going to take some so-and-so because I feel lousy. And people overdosing and actually like killing their kidneys from just overdosing.
So in particular, Tylenol, safe for the kidneys, bad for the liver.
Oh, I got that backwards.
Yeah. And so people who overdose on Tylenol end up getting liver failure.
Oh, gosh.
And unfortunately, I mean, it's a really long process. You know,
Yeah.
your liver does a really good job of being able to regenerate and heal. So the process with acute injury from Tylenol is really long, and you're in the ICU. It's it's a difficult process.
But it can regenerate some.
Yes, the liver can, absolutely.
Can kidneys?
Kidneys don't regenerate really well. So if you have acute injury to your kidneys, yes. But if you have chronic disease processes that are causing scarring inside of your kidney, that scar tissue will never be functioning. And so what happens is that your kidneys function and the scar tissue builds up and the damage builds up over time. And you don't feel that your kidney's ability to function is going down until it gets really low. So kidney disease is broken up into 5 stages. There's stage 1, stage 2, 3, 4, and 5. Okay. The majority of people with kidney disease don't even find out that they have kidney disease until they're stage 4. You qualify for a transplant at late stage 4, early stage 5.
Oh, my gosh.
And so you're talking about 20% function. So kidney disease, you feel just fine if you're 40, 60% functioning, but that is still on the pathway and putting you at risk for kidney disease in the future if you don't stop the process that's causing the harm in the first place.
So swelling, do you urinate more or less?
So as your kidneys start to fail, you may notice that your urine gets very frothy because of protein from diabetes in particular.
Whoa.
You may have really dark concentrated urine, and as your kidneys start to fail, you may have less urine.
Mm-hmm.
And that also kind of depends on what your disease process is.
Okay. If you're just joining us, I'm Anna Marie, and this is Focus, and we're talking about transplant surgery and kidney transplants in particular with transplant surgeon Dr. Jacques-Franz Guiteau. He is at Ascension St. Thomas West at the Kidney Transplant Center. We were going to compare kidney transplants with dialysis because people are afraid of the surgeries. Mm-hmm. We wanted to kind of address that.
Yes. So most of the time, people end up going on dialysis when they are stage 5 kidney disease, which is 15% or less. And at that point, they also qualify for a transplant. But I think where we fall short in educating the public about their options is that really we should be pushing transplant as a number 1 treatment for kidney disease.
But do we push that as number 1?
We don't. The vast majority of people will go on dialysis and then go to transplant centers after they've been on dialysis for a period of time. And I think that is something that goes all the way back to medical education. Even as a medical student, I'm looking back at my training, and we talked about dialysis way more frequently than we talked about transplant.
As the first line.
Yeah, and I think maybe that's the first line because it's the least invasive up front in terms of a big operation versus some of the smaller operations you need to have.
And surgeries weren't as successful way back when.
Sure.
Okay.
I think, surgical technique is always improving. But we've gotten to the point that kidney disease is very treatable with transplant.
Wow.
And so when people are faced with a choice, looking at transplant versus dialysis as their treatment options, what I generally tend to tell my patients is that if you were to start dialysis today or get transplanted today, you would live twice as long with a transplant as you would on dialysis.
Whoa.
That's big numbers, right? And so when you look at 1-year survival on hemodialysis, which is the most prevalent form of dialysis, At 1 year, 80% of people who get started on dialysis live 1 year.
Okay.
1 in 5. Okay. So at 5 years, only 40% of patients live 5 years. So you're looking at out of 100 people starting on dialysis, hemodialysis today, only 40 of them will be living 5 years from now.
Wow.
If you look at those same numbers for transplant, at 1 year, you're talking about above 90% survival. And at 5 years, you're talking about above 75, 80% survival.
Wow.
And those numbers are really big, and they're also very, very scary. The thing I always also like to mention is that, transplant is a big endeavor. It's not necessarily for everyone, right? There are situations where people are better served with dialysis based on some of their disease processes and things like that. But I do think everyone who has late stage 4 or early stage 5 or is end stage kidney disease at least deserves an opportunity to get educated about the potential for transplant. And they should get that education as soon as they possibly can so that they can make a decision about whether or not that's right for them.
Oh, my goodness. How can people afford it? Do insurances pay for it?
Yes. Well, the wonderful thing about kidney disease, and I don't know if this is wonderful, but it's one of the 3 qualifiers for Medicare. So if you have end-stage kidney disease, you're on dialysis in particular, you qualify for Medicare, and Medicare pays for transplant. And so I would say upwards of 75% of the patients we transplant are on Medicare because they're on because they have chronic kidney disease or end-stage kidney disease, and so. That covers their surgery, recovery, and then all of the different part A, Part B, and then in particular, Part D pays for immunosuppression medications afterwards. It's not a surgery that you need to start thinking about in terms of how am I going to pay for it.
Yeah.
More so, it's talking to your insurance company, if it's not Medicare, or even if it is Medicare, talking about what their transplant benefits are.
Oh, wow. Yeah, I think that is probably a big, big concern. It's like, I probably need this, but there's no way it'll just sink us.
No, and I think that's also why in the transplant center, we have transplant financial coordinators. So if someone were to apply to our program to get evaluated for transplant, one of the first people who looks at their record will be our transplant financial coordinator, who will contact your insurance provider and make sure that your transplant is covered and that Ascension St. Thomas West is in that network, right? So a patient would not be able to get a transplant at Ascension St. Thomas West or any other transplant center if their insurance did not cover for it or that program was not in their network. And that is done on the front end from the transplant centers. That falls on the transplant center. So if you go to a transplant center, you will talk to a transplant financial coordinator that will go over what your benefits look like, talk about deductibles, talk about what your medications cost after transplant, et cetera. So that's a part that happens up front before you have a transplant.
How long have you been with Ascension St. Thomas?
I joined Ascension St. Thomas in August of 2023. I think as physicians, when you come out of training, sometimes you get bogged down with a lot of the things that happen outside of medicine, right? With the things that we don't train for, the charting, the late hours, the administrative burden that gets put on physicians.
Yeah.
But I think Ascension St. Thomas does a really good job of putting the most important thing first, which is the patient.
Yeah.
And I think that is a great way to practice, and that's a great way to stay focused. There's a lot of burnout in a lot of different physician practices, but as long as you're keeping the most important things first, your patients, and then of course yourself as well in terms of self-care, there's nothing more fulfilling than being able to serve patients like that.
This is a little side jaunt here, but I want to ask you, and if I'm putting you on the spot and you can't answer, then please don't. When you said something like a lot of burnout, my brother-in-law was a radiologist, and he was on call all the time, early hours, late hours, and he retired. And he kind of has post-traumatic stress disorder where he can't sleep, he can't go to bed. I'm going to have to get up in 4 hours. Is there a lot of burnout among physicians and among people who are in that? Because it's like crisis time all the time.
No, that is you're describing my night last night. I'm waking up at 4 a.m. thinking my phone went off or my pager went off. And I do think that is a part of the job in the sense that we knew that there was going to be a little bit not even a little bit. There's going to be a lot of stress involved with taking care of people. I mean, these people's lives are in your hands at times.
Yeah.
But I don't think that necessarily is an excuse for us not to pay attention to how we're feeling, right? I think everybody has to take a step back and make a decision about what medicine means to them in terms of their health, and then how they define themselves as a person.
Okay. If you're just joining us, I'm Anna Marie, and this is Focus, and we're talking about kidney transplants, the need, how many people need kidney transplants, how wide a need is that?
There's a huge need. In the United States, there's about 90,000 to 100,000 people on the kidney transplant wait list.
Wow.
Within Middle Tennessee, there's about 3,000 people on the organ wait list. So that's all organs, but the vast majority of those patients are kidneys. The most transplanted organ in the country are kidneys.
Oh, okay.
And we do anywhere between 25,000 to 30,000 kidneys a year.
Oh, my gosh.
But we add probably 30 to 35,000 people to that wait list. So every single year, the wait list gets longer. And so when you're waiting for a deceased donor kidney transplant, depending on where you live, wait times can be anywhere between 3, 5, 7 years, depending on your blood type. And that's here in Middle Tennessee. If you were to live in a more, dense area like New York City or California, those wait times go up to 7, 8, 9, 10 years.
Oh, my gosh.
And it's really scary because, like I mentioned, only 40% of people will live 5 years on dialysis.
Oh, my gosh.
So the sooner you get evaluated, the sooner you get listed, the sooner you get transplanted, the better off you are.
Yeah. And then you're not having to try and outlive the clock with your
Right.
dialysis to get that transplant.
Right. And I quote those numbers. And like I said, I'm not meaning to scare anyone who's on dialysis, because dialysis is it has come a long, long way. And I know people who have been on dialysis for 10, 15, 20 years. I've transplanted people who've been on dialysis for double-digit years.
Yes.
And I think the most important thing for those patients is that if you're on dialysis, making sure that you are following up regularly with your nephrologist, making sure you're getting all of your lab work done, you're not going outside of the scope of what you need to do to take care of yourself off of dialysis, and you can live a long life on dialysis. But again, it pales in comparison to transplant, because not only are you only getting 20% of a kidney, you're not getting all of the extra benefits of having a full kidney in terms of energy. Most people tell me after they get transplanted, they feel like they're 20 years old 6 months after the transplant, because they didn't even realize how dragged down they were feeling from their kidney disease.
Because it was a gradual descent.
Exactly.
So what is the life after a kidney transplant?
So once you get transplanted, you're in the hospital for about 3 to 7 days, depending on how you recover.
A week?
Yeah. Our average length of stay at Ascension St. Thomas West is 4 days.
Whoa, I'm just so amazed. That's amazing.
I will tell you, to go through that type of an operation and get those medications that they get for the anti-rejection medications afterwards, and to go home in 4 days, I'm amazed at every single patient that gets up and walks out of there. And they all do, which is a blessing.
Yeah.
Right. And so patients are at home within a week of transplant. They come into the clinic, the transplant clinic, twice a week for the first month, once a week for the second month, every other week for the third month, and then monthly for the rest of the year after a transplant.
Is that forever?
And they're coming to the transplant center forever. And within our program, once you get to about 3 years post-transplant, we start to transition their care to their primary nephrologist in terms of all of their care.
Yeah.
We start sharing care with their primary nephrologist within the first 6 months to a year. But you always will need to have specific follow-up for your transplant, because you're on medications that require us to check levels and make sure that those levels are therapeutic.
Yeah.
And so you always will be getting those labs. So someone will always have to be paying attention to the fact that you've been transplanted.
I bet you see people come in and go and just be so happy to see you. Like, yeah, hello.
Well, I'm not to brag at all, but I think that the relationship that you develop with your surgeon at the time of a transplant is nothing like you've ever experienced.
You mentioned that earlier, the relationship that you are able to have with post-transplant patients.
Yeah. I mean, no other field of surgery are you operating and getting that immediate gratification of a successful operation, and then going on to have a long-term relationship with your patients. And that is what really drove me into going into transplant, is because these patients, I just yesterday in clinic, I came through the clinic waiting room, and I saw a patient I transplanted when I first got here. And they said, Dr. G, I'm doing really well. Look at me. And I was like, oh my gosh, you have lost weight. Yeah, I'm back to working. I'm working out. I mean, people go, it's night and day, the difference in terms of how people feel after getting a kidney transplant. And I think that is just, I keep going back to that, so rewarding. And that's so, but that really is what gets you up every single morning. Mm-hmm. You know, if I'm doing a transplant, sometimes we do them in the middle of the night, and that's okay. But the fact that that kidney will start to produce urine sometimes on the operating room table before I'm finished with the operation itself, in itself is gratifying.
That'd be me waking up, I gotta pee. Well, so is there anything else that you feel is important for us to add that our listeners need to know about the process, or about anything in general like that?
Yes. The most important thing about seeking a transplant is if you know someone who has chronic kidney disease, or you have chronic kidney disease, ask your nephrologist or your primary care physician or your endocrinologist about transplant, and ask to be referred so that you can get educated about what transplant might mean for you. Mm-hmm. And then, if for those people who are on a transplant waiting list, if you are able to find yourself a living donor transplant, that is the most important part of transplantation, in the sense that people are very successful with deceased donor kidneys, but living donor kidneys last twice as long as deceased donor kidneys.
Oh, wow.
So we're looking at 7 to 10 years on average of a deceased donor kidney lasting. Live donor kidneys last on average 15 to 20 years. And those kidneys work right away. And I can go on and on and on about the benefits of living donation. And we take that very seriously at Ascension St. Thomas West. We have a whole program around educating our patients about how to find a donor. We're going to be starting a program about educating donors about what it means to become a donor and what that looks like. And it's really because if you're waiting for a deceased donor kidney transplant, you might as well be looking for a live one. If you're waiting 3 to 7 years,
yes,
you might as well be looking for a live one in that time, because we can take your wait time from 3 to 7 years for a deceased donor kidney to 8 to 12 weeks, getting you prepared for your live donor one.
I would be interested in finding out what it would take, what makes someone eligible to be a live donor.
Any healthy adult can be a live donor.
Any age?
Anybody over the age of 18, but I would say anybody over the age of 25, mostly. Between 18 and 25, I think you really have to look at what that means for their health long term, and making sure that people understand the risks of surgery and the risks that come with donating a kidney. Mm-hmm. And so that is just general criteria, right?
Yeah.
Obviously, if you have diabetes, you probably should not be donating a kidney. If you have high blood pressure that's uncontrolled, you probably should not be donating a kidney. If you have cancer, so there are a list of things.
I gotcha.
You know, so any healthy adult above the age of 25 who's interested in donating a kidney can go to the Ascension St. Thomas Kidney Transplant website and actually put in an application. We have a link that sends you directly to an online medical questionnaire that I personally review, and then make a decision on whether or not you're a candidate to donate a kidney. So it's a long questionnaire, but all of that information is really important in making sure that you're healthy enough to undergo that type of an operation.
Is it expensive for a donor to donate a kidney?
Anna Marie, you just know all the right questions. Because
I've thought about this.
Yes. Well, because the donor workup, the donor surgery, the donor recovery, covered by the recipient's insurance.
Oh my gosh.
So the donor does not come out of their insurance to do that altruistic deed, right? Mm-hmm. And then we go even a step further across the United States. There is the National Living Donor Assistance Center, NLDAC is what we call it. It provides potential compensation for missed work, travel expenses, lodging.
Yeah.
And so we ask all of our donors to apply for that. And if they get it, they also get reimbursed for missed time at work. So we try to make it so that people are not burdened by their gift. Mm-hmm. If someone were to develop kidney disease after being a live donor, that's very rare. About less than 1% of people who are live donors develop kidney disease in the future because they're so heavily screened. But if someone who donates does develop end-stage kidney disease needing a kidney transplant, they get extra exception points, which will put them at the top of the list, or at least near to the top of the list for deceased donor kidney.
That's amazing. If I donated a kidney, then when I got well, could I play basketball?
Absolutely.
That's good because I can't now. Woo!
I was about to say I'll join you on the court.
Fantastic.
We usually, and actually we tell our donors that within 6 weeks, you're back to sports.
This is eye-opening and just so uplifting and encouraging. Thank you. Thank you for your expertise and your time.
Oh, thank you so much for having me on. I obviously think this is a very important subject.
Yeah, clearly.
And if you give me the opportunity to stand in front of one person, I'm talking the same.
Good. That is Dr. Jacques-Franz Guiteau. He is a transplant surgeon at Ascension St. Thomas West. And the Kidney Transplant Center is something that we're going to put some links and information up for on our Focus Facebook page. Thank you.
Thank you.
Make sure you join us again next week, please. I'm Anna Marie. That's Focus.